Hi, thanks for tuning in to episode number 70 of the Doctor Podcast Show. And I'm your host, Dr. Robert Seichert. And we'd appreciate if you could subscribe and follow Doctor Podcasts and also like and repost this episode because we'll have even more guests, great guests like we have today. Today, we're going to be discussing a very important topic. It's a little depressing, but it is very important, and that is addiction. Unfortunately, we have a plague of drug addiction in the USA, and it seems to be getting worse in recent years. According to the latest CDC data in 2022, approximately 108,000 people in the USA died from a drug overdose, and that number seems to be increasing every year. Also, there's about 80,000 fentanyl overdoses every year, and that has been climbing as well. So today we're going to talk about that with an expert, one of the world's leading authorities on drug addiction. In fact, Dr. Harris Stratyner. Dr. Stratyner is a nationally recognized psychologist in practice in Manhattan, in New York City, in Stratyner Associates. And he is an assistant clinical professor of psychology in the Department of Psychiatry at the prestigious Mount Sinai Medical Center here in Manhattan, in New York City. Dr. Stratyner is also helped found the Retreat, which is in Westchester County, which is a cutting-edge rehabilitation center that treats executives, celebrities, and other high-profile individuals who, given their visibility, would not seek treatment otherwise. He's also the chairperson of the Westchester County Department of Community Health Subcommittee on Substance Abuse. And previously, he was also a professor of psychology at the Cornell Medical Center here in Manhattan as well. So, Dr. Stratyner, I really appreciate you taking time from your busy schedule to speak with us today about addiction and substance abuse. Thanks very much.
My pleasure, Dr. Seichert.
So I want to start by, can you define what addiction means and what substance abuse or drug abuse means? What's the official definition of that? And how do you distinguish that from other mental health disorders or conditions?
Mm-hmm. So addiction is a disease, and that's the first thing we have to recognize. And I always like to say to my patients that the word disease can be divided. It's a dis-ease. But addiction itself is a brain disorder. It's a brain disorder, and to some extent, it's also a disorder of the liver. Addiction, like any other disease, is primary, progressive, chronic, and if not treated, fatal oftentimes, and certainly destroys people's lives and people's families. And right now, we're seeing more deaths among adolescents from addiction overdose than from anything else. Can you imagine?
That's the leading cause of death in adolescence.
Yes.
Very depressing.
Yeah, it is. The good news is we do see a lot of recovery. And the funny thing is, and I find it so ironic, is that alcohol is probably one of the most dangerous. And I'm not saying we shouldn't drink. I'm not in recovery. I'll have a glass of wine. But alcohol is one of the most dangerous substances you can use and causes an effect on every cell in the body. And yet alcohol is legal, right? And I'm not against anything. I actually believe in some ways, maybe all drugs should be legal. There's a lot of pros for that. And yes, we could also make some arguments that there are a lot of cons. It's the same thing. I hate to use this as an example, but prostitution, aside from the moral aspect of it, it would certainly help clean up a lot of venereal diseases and sexually transmitted illnesses. Same thing with addiction. You know, we would stop stigmatizing people. Addiction is a mental illness. It's listed in the Diagnostic and Statistical Manual of Mental Disorders. But it's also different in the sense that if somebody has, for example, bipolar disorder, they certainly have an increased chance of developing addiction because they self-medicate. Edward Kansian, God rest his soul, professor at Harvard, talked about the self-medicating model in addiction. And a lot of people do that. A lot of entertainers, you see a lot of addiction among entertainers because they have performance anxiety. And they're constantly on the road and they're constantly traveling and they lose, they're going through time zones. And so they'll oftentimes drink, they'll oftentimes smoke marijuana, and everybody minimizes marijuana. And I want to be very clear. Not everybody is an addict. Marijuana is becoming more and more legal, right? We know that.
Right. In New
But
York, you'd smell it on every street. Yeah.
Absolutely. But at the same time, and certainly if you walk around Manhattan, you smell marijuana on every street, right? But certainly marijuana can have a devastating effect on folks. It can make you feel lazy, lethargic. It can prevent kids from doing their homework and paying attention in school. At the same time, I have patients who smoke marijuana in what we would term a harm reduction model to help them, and they use medical marijuana. And I've seen a lot of benefits to that. So you've got to be careful. You have to understand the distinction. Let's say somebody, God forbid, had schizophrenia. I would not recommend that they smoke marijuana. It can make you very paranoid. Then they would develop paranoid schizophrenia. So there's a lot of, aspects to the addictive process. We've seen a lot of research, recent research on addiction. Certainly, addiction has always been associated with the mesolimbic system and with dopamine, one of the neurotransmitters in your brain, and it's a reward pathway. And many people reward themselves, right? After a hard day of work, you go home, let me have a cocktail, let me have a martini. But I don't want to demonize addiction. Not everybody is an addict. And many people can drink safely and effectively, where it doesn't hurt them. The latest research, Robert, you might find interesting, is they're starting to look at the transcranial system in terms of the motor cortex, which is fascinating. The motor cortex. What would movement have to do with addiction? But the supplementary motor cortex has been studied now, and they're looking at it in terms of relapse. And one of the things they're using is transcranial magnetic stimulation to try to prevent relapse. And there are other drugs that are involved. Some people say relapse is a part of addiction. It does not have to be. So that's something we need to be cognizant of.
Right. What about one thing I don't understand? That there's so much in the news about opioid addiction, heroin, fentanyl, and we know that it kills people. Yet there are people out there who will try it and think they can get away with it, use it once or twice and not get addicted. And of course, it's extremely addicting. Why do people do that after hearing in the news every day about how many people are dying from it?
So, a very good question. And multivariate kind of question. Again, people with psychiatric illness, like let's say bipolar disorder, if they're manic, they might want to get an even better high. And if you look at opioids, you'll see certain opioids are unbelievably devastating, and addicts fall prey to illegal forms of opiates, and they also often pushers, dealers, manufacturers. A lot of it comes from China. Will cut certain drugs with fentanyl, which is 100 times stronger than morphine. And they think they're just getting high. A kid thinks he's just getting high. He's gonna, do fentanyl. Feels good. He had his wisdom teeth out. If they didn't use fentanyl, but they used an opioid. And
Codeine.
yeah, it's safe, right, in their minds. And so, before you know it, you get addicted. And also, addiction has a tremendous genetic predisposition to it. When I first meet with a patient and to do an assessment, I talk to them about their families and I do a thorough anamnesis. I look at the beginning of their addictive process right up to the current moment that they're meeting with me. And it's important to do that. You will see, I've had patients who say to me, I got addicted to fentanyl, or I got addicted to OxyContin or oxycodone. And I don't understand it. There's no addiction in my family. My dad was an alcoholic.
Hmm.
Excuse me? Your dad was an alcoholic? Yeah, but he wasn't an opiate addict.
Right.
Well, that's cross addiction. You know, you could be addicted and smoke 2.5 packs of cigarettes a day. My Jewish great grandmother was a 2.5 pack cigarette smoker a day, and of course that's addiction, right? Nicotine is a very addictive drug.
Right.
So we need to be aware of that. We need to start to look at the subtleties. The beautiful thing about the internet, even though you can become addicted, that's called a process addiction to the internet. But the beautiful thing about the internet is there's so much information out there. The most important thing, however, is you go to good sources. So you would want to look at various journals, respectable journals. See, I was editor for a time, visiting editor of CNS Spectrums. You want to look at things that have legitimacy.
Right.
And so you
Major
find out
medical centers, for example.
exactly. Yeah. So, addiction's a real devastating illness. And
So if there's a family history of any kind of addiction, doesn't matter what the drug is or it's alcohol, you have an increased risk of becoming addicted to
absolutely,
any drug that you take.
absolutely.
Right. What about what's the difference between substance use intermittently and full-blown addiction? Can some people actually get away with just occasional use of these drugs?
I'm in my sixth decade of life, and I've been in this field for 45 years. There would have been a time I would have told you no. But the reality is, yes, some people can use drugs and they just have this ability. Perhaps they don't have a genetic predisposition. Perhaps they're lucky, and they can use cocaine on occasion. I'm not advocating for it. I have never, again, I'm in my 60s. I've never used cocaine in my life. I wouldn't dare. And I have addiction in my family, in my extended family, alcoholism on both sides of my family. And I mean, you need to be aware of that. You need to be aware of what are the variables. That's why I said multivariables.
Right. And since you can't tell who's going to be just the occasional user and whether you'll be addicted after using fentanyl or heroin once, it's best to just stay away from it and never use it.
Right. I think you'll recall a drug that was very big in the 70s and 80s, crack.
Yeah.
Crack cocaine was uh, pre was a free-based cocaine that you would smoke, and people became addicted to it after using it once. So yes, there are a lot of addictive processes, but there is substance use, and then there's substance addiction, and it's important we take
Right.
note of that.
So the lucky few sometimes can get away with substance use, but the
Absolutely.
vast majority of people are going to get addicted. So best bet is to not ever even
Stay
try
away from
this
it.
drug. Stay away from it. There's other things to do. Now,
But
you
see,
mentioned marijuana or cannabis. It's now legal in New York and many other states.
yes.
Is that a gateway drug or is it not? That's been debated over the years and decades.
So I'm
Is
going to give you,
cannabis use going to lead to other drug addictions?
so I'll make believe I'm a politician and I'll talk out of two sides of my mouth for a moment.
All right.
I just realized some of the politicians I treat might not like that remark. Um, the reality is some people can smoke marijuana their whole life and never go on to anything else. Some people can drink, be an alcohol user, never become addicted, never go on to anything else. Some people can take opioids because they had hip surgery, let's say, or other major surgery, and they never go on to getting addicted. But again, it's all the variables that play into it. And did you ever notice, for example, what's your pattern? Let's say, well, let's use alcohol. Let's make it simple. What's your pattern of drinking? Do you drink to relax? Do you notice that when you go out to dinner, you start with a cocktail, and then you go on to a bottle of wine with yourself and, let's say, your wife, and you split a bottle of wine, and then lo and behold, you have another half a bottle of wine, and then have the sommelier cork the wine. I mean, are you headed towards alcoholism? These are all things that we need to be aware of. And people, you see, there are two sides in the addiction field. There's the addiction folks, like in New York, we have the Office of Alcoholism and Substance Abuse Services. And then there's the mental health side. And many people, many people, if they have psychiatric illness, anxiety disorders, performance anxiety, OCD, they're very popular, obsessive compulsive disorder. And as we push kids in school, we're seeing a lot more of it. They're going to have a greater propensity towards self-medicating.
So if you have any type of mental disorder or condition whatsoever, you're at much greater risk of getting addicted to whatever substance you're going to use. Is that
Absolutely. And you can also become an iatrogenic addict. Lovely. I love to use big terms. See, psychologists don't prescribe medication, even though I wrote the PDR on pediatric and adolescent mental health. I don't prescribe. They're just in 12 states. As a psychologist, you can prescribe, and I think eventually they will prescribe. But one of my areas of expertise are psychotropic medications. And I would tell you, if you're on a psychotropic medication, an SSRI, a selective serotonin reuptake inhibitor, or you're on a mood stabilizer like lamotrigine, I'll clean it up, stay the heck away from using drugs and alcohol.
so? If you have depression and you're using medications for that, stay away from any of those drugs.
And guess what? And most people don't know this. Alcohol is a central nervous system depressant. Most people think it's a disinhibitor because initially you go to a party, you go to a bar mitzvah, a wedding, and you have a drink and you feel a little loose. You're meeting the other side of the family, the bride side or the groom side, and it loosens you up a little bit. But if you start to drink alcoholically over time, you become depressed. And eventually you'll develop major depressive disorder. And if you already have dysthymia, mild depression, lasting a couple of years, it can develop into major depressive disorder. So you're really, again, the word cognizant. You need to be, and I'm a cognitive behaviorist. Traditionally, I was very psychoanalytic, but I always wanted to make sure, let's get rid of the problem before we understand why we have the problem.
So you mentioned cognitive behavior specialists. What are the effective treatment modalities that you use for addiction? Um, is it the same for all the different drugs, for opioids, alcohol, marijuana, or do you use different treatment modalities for different drugs?
So before methadone, and I may make some enemies here, became an industry, methadone was a big replacement for opiate addiction, heroin addiction, for example. We recently, not recently, I'm sorry, We have come up now with using things like buprenorphine. We'll use naltrexone. We use for alcohol. A lot of people associate certain medications for the opiates to help you. For example, you'll often see certain drugs that are agonists and antagonists. So they'll stop you from having a very big reaction, but at the same time, they'll curb your high and give you a little high. So one of the things that's become very popular is buprenorphine in treating addictions. And here I'm talking about medically assisted treatment, chemical drugs. But in terms of cognitive behavioral therapy, that's probably the most popular, along with spin-offs in a sense, dialectical behavior therapy. And you also have to remember people have personality disorders. For example, Marshall Linehan, who's the founder of dialectical behavior therapy, really helped us to understand that people with a borderline personality disorder oftentimes abuse drugs and alcohol. It just goes hand in glove with that particular personality disorder. So you can have a major clinical syndrome, but you can also have a personality disorder. For example, many people with bipolar disorder, you'll find have concurrent personality disorders. I don't want to get political here, but some people have malignant narcissistic personality disorders. Some people just have narcissistic personality disorders. I've never been one to shy away from kind of topics that maybe you'll edit this out, but topics that point to things in people. And people have borderline personality disorder. They have obsessive compulsive personality disorder. I absolutely have OCD. And when I was a kid, I received medication for it. I will tell you, ironically, I think it's what made me graduate, I'll brag, summa cum laude, and also get an award and an honorary doctorate in addition to my earned doctorate.
So little OCD is good, but
a little OCD is good. Too much is not good, And don't always think of the person with OCD as Felix Unger. Many people with OCD are hoarders. They're so obsessed with cleaning that if they don't clean perfectly, they just let things go to heck. And can I say hell? Sounds a little more effective.
Yeah, this is
okay. And I know you're
2024.
Okay. So, it really hurts them. And you can have an obsessive compulsive personality disorder. You can have obsessive compulsive disorder. You can ruminate. I was the ruminating type. I would worry about things when I was a kid. I was one of those little kids who, over my Haftorah, and I'm not even that Jewish. My wife is Irish Catholic, but my daughter is Irish Catholic and Jewish. She goes to confession, but she brings an attorney, so it works out very nicely. You have to have a sense.
So you're also a comedian on top of being
well, I'm going to tell you the number one. I didn't mean to interrupt you. The number one defense mechanism, I would argue, and I mean this sincerely, ego defense mechanism is humor. If you can treat things with humor, recently a patient said to me, "Doc, you shared your age with me. I know you're in your 60s. Are you afraid of dying?" And I said, "Yeah, on some level, I get scared about dying." I said, 60 these days is, pretty young, being in your 60s. I said, we hear people say, "Oh my God, she was only 73. That's young." And we see people living on into their 90s, right? Clint Eastwood, I think, is what, 95, 96 years old.
Yeah, I have lots of patients in my practice as an ophthalmologist in their 90s. I saw a few patients today who were in their 90s and doing great.
My oldest patient is 97, a very famous retired actress, and she's totally with it. I should have I'll use a technical term, the sechel that this woman has, the kind of wit and the kind of real intelligence. And you do see that. So, I don't want to look at only one side of the coin. Let me come back to the point I was making.
Right.
I said to this patient, I got to tell you, being in my 60s and approaching the last part of my life, or the later part of my life, has really helped me to stop worrying. Because if I really get to the point where I'm obsessing, and which I can, I say to myself, Harris, in 20 years, you're going to be such and such an age. Why don't you stop already? And that's a form of cognitive therapy, right?
What's the point,
Exactly. Let's enjoy our lives while we're here. And of course, we talk about a lot
But
of
let's not do anything stupid while we're trying to enjoy our lives.
Right. You don't want to drink a fifth of scotch and drive your car.
You don't want to take any cocaine. You don't want to take any oxycodone.
Absolutely.
And
Absolutely.
probably best to
Yeah.
avoid marijuana as well, because I hear young people are having psychotic episodes from marijuana.
There's no question. I hate to say it, and I know there's a lot of people who are going to watch this, especially younger people, and they're going to go, "You don't know, you're out of your mind." No, I'm not.
Yeah.
I have seen people have a psychotic break who were approaching the age of 18. There was schizophrenia in their family. They started smoking marijuana at the age of 14. And by the time they reached 20, 18 to 20, they developed schizophrenia or schizoaffective disorder, which is kind of like a combination of schizophrenia and a mood disorder. Why take a risk? Why can't we enjoy? Why is it I'll have a kid who will come to me and say, I'm going to Disney and I'm going to smoke a joint before I go on the roller coaster so I can really get high. You're going to get high enough on the roller coaster. You don't need a joint. Yeah.
That's right. Read a good book. Write a book.
Exactly.
Do well in school. Have some goals and ambitions. That'll, if you reach your goal and are ambitious, that's the best high of all, if you can accomplish something.
There's no question about it.
Right.
I started saying earlier that there are two sides. So there's the addiction side of professionals. I'm also a credentialed alcoholism and substance abuse counselor. I don't even put that down after my name, but I'm a doctor of psychology. So I look at things like 12-step programs like AA. Some people put them down. I don't put them down. Do I ever disagree with certain things? Yeah. But do I know that my patients who religiously go to AA, AA gets in the way of your drinking? And I think it's wonderful. And you get a sponsor and it doesn't cost you anything. We have so many rehabs that are springing up. We have rehabs all over. There are rehabs that can cost you $120,000 a month.
A month.
And don't take insurance. There are other rehabs that are covered by your insurance. There are many fine rehabs. And I was the senior vice president of one of the oldest rehabs in the United States, Caron Treatment Center, in Pennsylvania and Florida. It's a fantastic rehab, and it takes insurance. And you just need to be aware that there are many different ways to skin a cat, and there are many ways to get sober. But cognitive behavioral therapy, in a quick sentence, you change the way you think, which in turn impacts your behavior, and that new behavior reinforces new ways of thinking.
Tell us about carefrontation, which is something you're a proponent of.
So actually, I'm the father of carefrontation. I was shocked. Recently, a patient of mine said to me, if you put in who's the father of carefrontation, it comes up Dr. Harris Stratyner. I didn't know that. So when I was director of outpatient services many, many years ago, I was starting out at Four Winds Hospital. I discovered carefrontation. I saw too much confrontation going on. And that came out of an early movement in the 60s called confrontation, called therapeutic communities. They would make you clean the grout of a toilet with a toothbrush, you'd be punished. They'd shave your head. That's not the way you treat somebody with an illness. And again, it's time we realize addiction is a disease. Again, primary, progressive, chronic, and potentially fatal if not treated. So I came up with Carefrontation, and I borrowed from Cousins, Norman Cousins, who used it in a different area. He used it with being carefrontative with people who were dying from terminal illness. And I applied it to addiction. And my doctoral thesis was on the use of carefrontation, not shaming or blaming patients, but getting them to take responsibility. Look, I have recently developed type 2 diabetes. I'm not a heavy person. It's not on either side of my family, but I still developed it, and very mild. And now, thanks to the GLP-1s, I'm doing pretty well. But the reality is nobody shames or blames me because I have type 2 diabetes and I can't eat sugar. So what they do, they say to me, shame on you. You're in that, what's the matter with you? You can't eat sugar. So
it's a good analogy.
What I try to do is I try to look at addiction that way. Don't shame or blame, but hold people responsible. I'm held responsible for watching my diet. So I try to do that as often as I can. And once in a while I cheat and I'll have a piece of cake or I'll eat too many carbs. But, I have something that's stuck in my arm, Dexcom, that tells me when my sugar's going up. And, I try to do the best I can. But we got to get away from confrontation. Confrontation is, I like to say, confrontation is for convicts. Stop stigmatizing people with addiction.
It's very important. Now, you mentioned that you take care of lots of celebrities, famous people, even politicians who obviously don't want this publicized and
Right.
don't want anybody to know. How is that treatment different than the average person who comes to you? What special things do you have to do? In other
One of the
words,
things,
how do they get to your office and not
right.
be recognized in the building or in the lobby?
Sometimes they are, but one of the things that you do when you come to see me is you sign forms, and one of them is whatever you see in this waiting room stays in this waiting room. And if it comes to my attention that it doesn't, you're no longer going to be working with me. I'll refer you to somebody else. I've had many celebrities who have sat in the waiting room, but usually what I do is I very OCD. I very carefully tie my patients so you don't run into anybody. For the most part, has it ever happened? Sure. I'm going to tell you something though, Robert. Many famous people get the worst treatment possible.
Really?
Because they're taken advantage of. They have money and they're not held accountable because they literally, I know people are going to be offended by this, but they can be bought off. And the people they hire around them really have to be carefully screened. I've had some very famous celebrities, Academy Award winners, Grammy winners, all kinds of folks. And I grew up in that world because my dad worked in that world. And they've asked me, could you interview? I'm hiring a new assistant. Could you make sure they don't enable me? And enabling is a key word there. When you look at addiction, it affects the entire family. You have different roles that are played. Wexshire Cruz, a researcher, talks about this. The class clown who takes the onus off, let's say their mother or father who's an alcoholic, so they'll make jokes. The lost child who stays in their bedroom and reads a book and doesn't want to get involved. And the roles go on. And sometimes the hero is going to score all the touchdowns so that instead of their father or mother being the town alcoholic, they're going to get the credit. Oh, look, he's a football star, the son. And you can, again, overlap these roles. So there's so many intricacies to addiction. And you really have to be aware of it. But celebrities, oftentimes, if they're not careful, will get the poorest treatment. They really need a doctor who's not going to enable them, who's not going to say, well, you're on television or you're in the number one movie, so I'm going to be so impressed with you. And doctors, psychologists, psychiatrists, psychiatric social workers have to have boundaries. You really need to have boundaries. Now, have I ever had to be backstage at a celebrity's concert because they truly needed me as a doctor to go back on stage after they, finally got 6 months of sobriety? Yes. But I don't go out with patients. In other words, I'm a happily married man. I don't mean go out that way. I mean,
Right.
I don't, go to dinners and socialize with patients, just like other doctors. I try to have boundaries. I have very strong boundaries.
Right. Now, celebrities, some of them have stage fright and other anxiety, performance anxiety. Does that lead to addiction as well?
Absolutely. I mentioned earlier that performance anxiety is one of the biggest things in the world of a celebrity. An actor, an actress I had one particular celebrity who was a movie star, but they were asked to do a play on Broadway. They were fine as a movie star, but when they had to get in front of a live audience, they started to panic and they relapsed on alcohol.
Wow.
And to the point where they had to be sent to a higher level of care. There's outpatient treatment centers and intensive outpatient, there's individual treatment, et cetera, but there's also inpatient. And you got to remember things like benzodiazepines, things like Valium, right, Xanax, can cause seizures when you're detoxing. You've got to be very careful. Alcohol and benzos are the most dangerous things to detox from. You've got to be extremely careful. Cocaine, there really is no detox. You're not going to really get into that. You're going to feel uncomfortable as hell, but you're not going to get into as much trouble if you're a long-term alcoholic and just on your own one day say, I'm not going to drink anymore. That can be highly dangerous and should be done under the supervision of a physician, whether outpatient or inpatient. Yeah.
Yeah, I remember when I was a medical intern before I did my ophthalmology residency, I took care of many patients who went into DTs or delirium tremens from quitting alcohol suddenly, and you can die from this.
Absolutely.
Yeah,
And
very careful.
So many people have.
Now, many patients need some sort of medication-assisted treatment. And you mentioned that you don't prescribe medication. So do you work with their psychiatrist or primary
Yes, I
care
do.
physician so they can prescribe the buprenorphine or methadone or antabuse or other drugs that are needed?
Right, or something like an SSRI because the depression and anxiety are what's causing them to drink. So yes, I work closely with a trusted handful of psychiatrists. So now a lot of them are referred to as psychopharmacologists, and that's all they do is prescribe medication. But again, I'll just mention, I happen to have co-authored with Dr. Michael Bahar, who's a psychopharmacologist, and I invited him to write the book with me for Thomson Reuters, which was called the PDR on Pediatric and Adolescent Mental Health. And it was the first PDR for pediatric and adolescents. Can you imagine pediatrics? Because some babies are born addicted. A mother who's using crack, cocaine, or other drugs, and the babies, can you imagine, is born addicted.
Oh.
So
Now,
I'm pretty knowledgeable about medications. Yeah.
so you're doing the cognitive behavioral confrontation part of the treatment. Psychiatrist is prescribing the medication that's needed.
Right, but we'll
basically.
take a team approach. The psychiatrist and myself, will work together. And we'll talk to each other. They may say Harris. Now, maybe that's particular to the fact that I'm very knowledgeable about medications,
Right.
but I don't think so. And I think every psychologist has a professional obligation to learn about medications. They need to
They
know.
have side effects.
What if a patient decides they're going to stop taking their medication? They need to recognize some of the reactions that the patient's going to have. They may suddenly come into their office, they have bipolar disorder, they stop taking their lithium or the Depakote, and suddenly they're manic. They're racing all over the place. They have pressured speech. Those are things you have to look at.
Right. Now, I noticed you mentioned that you work with trusted psychiatrists. And how do you find trusted versus the opposite, non-trusted psychiatrists? And what is the
I
difference?
think it's taken me 45 years. And I think it's taken them 45 years to find trusted clinicians. There are some people who, work in the field and don't have they're not doctors. They're not doctors of psychology, not doctors of social work, DSWs, not doctors of medicine. That doesn't mean that they're not professionals, that they don't have master's degrees in counseling, etc. But they need to have an expertise, a real expertise in addiction. And many people, for a long time, I was dean of the National Council on Alcoholism and Drug Dependence in Westchester, of their credentialed alcoholism and substance abuse school. Education is very important, and that's why you've got to find the right people. There are wonderful psychiatrists. However, not all psychiatrists are addiction psychiatrists. You want an addiction psychiatrist. You want a psychiatrist who has studied co-occurring disorders. The person with major depressive disorder, suddenly you see their depression getting worse, but they're still taking the same dosage of medication. What's happened here? You get a
Right.
urine on them and you suddenly discover they're drinking. And alcohol, as I said earlier, central nervous system depressant. So you need to look at those things. Somebody may be put on a medication like Wellbutrin who has bipolar disorder, and Wellbutrin can raise your mood, or other antidepressants can raise your mood. But people with bipolar 1, for example, need to be on a mood stabilization medication, not just necessarily an antidepressant or anti-anxiolytic medication. And many people are on multiple medications. I'm not advocating. I don't want to run around and put people on medication if I can help it. And I'll work with somebody for a little while before I'll recommend them to do that.
Now, you mentioned also you take care of some politicians. That's a little bit frightening because these people are running the government, and that affects the rest of us, as opposed to celebrities. They can harm themselves, but they're not going to adversely affect the public. But what about politicians? How
Well,
prevalent is that?
and I'll mention politicians, but I'll give you another example. Many of the white shoe law firms have EAPs, employee assistance programs, because lawyers are human beings too, and can have alcoholism and get together with a client over drinks and dinner. Uh, Everybody is susceptible to addiction. When it comes to politicians, we've seen things like that many, many times, and it can destroy their career, but it can also make them a better politician and make them aware of the issues of addiction and help when they, are in the Capitol and they have to vote on a bill, or they want to put more money into helping people with addiction. So there's a negative and a positive side to everything.
You ever have to tell them, maybe you shouldn't be doing this anymore, being government official?
Well, let me go to our group of people. I've had to report people to the OPMC, the Office of Malpractice, of, professional liability.
Right.
Because how would you like to have a surgeon who was drinking until 2 a.m? Everybody's susceptible to addiction. I'm using alcohol as an example because it's legal and so many people can get a hold of it. But there are, dentists, surgeons, anesthesiologists, and don't tell anybody, but psychologists,
Psychologists also.
psychiatrists.
So it's a common problem, and these professions have greater access to these drugs, which is a problem.
Yes,
They
yes.
self-medicate and self-treat. Now, you mentioned certain addictions, certain drugs. There are medications that can help in treating the addiction, but others not. For example, you mentioned cocaine has no really medication treatment.
Right. I mean, in the old days, if we harken back to Freud, he had jaw cancer and he got addicted to cocaine. Sigmund Freud was a cocaine addict. And he had to use it because he was in so much pain. However, today there's no real value. Once in a while, you would know more than I, in the sense of, like, ENTs will sometimes use cocaine for nasal issues or things of that nature. But think about this. Here's where it really gets complicated. What if somebody has a fatty liver? And we know everything, right? Most things get processed through the liver, and they're drinking alcoholically, and they're lying to their primary care physician. What if someone has pancreatitis, and they tell their doctor, I think I got it because I was put on Manjaro, the GLP-1.
Right.
And indeed, what they don't tell their doctor is, and I'm drinking about 6 drinks a night of pure vodka, or I'm having doubles. That's why getting blood is so important. Having a full physical. I have my patients have full physicals. I don't like to, as a psychologist, do urines, but if I have to, I will. Yeah,
Because you need to know what they're taking in
absolutely.
addition to what they're admitting to. What about drugs like crystal meth? There's no drugs that can be used to help you get over that addiction?
There are certain combinations of medications that can be used, but oftentimes with crystal meth, you need to a higher level of care, and they do need to be in the hospital.
In the hospital.
And because you can go through tremendous pain. Crystal meth is an unbelievably dangerous medication. And this is interesting. I've had crystal meth patients be referred to me by dermatologists because your face can break out.
Right.
So there's an example where a dermatologist should take a course on addiction. If we all have to take, continuing education credits. So that's a good idea. Also, cultures are very important to look at. For example, and I'm not disparaging anybody, but there's a very high use of methamphetamine and crystal meth, in particular among the gay population. And it's known in the gay population. And I treat a lot of folks who were LGBTQ, and there's a lot of suffering that goes on in this world.
Right.
In terms of people who can't deal with how they feel. What about a kid who's inside their body? That's why I get so aggravated sometimes with current politics. What if there's a kid inside their body, they feel, even though they're male, but they feel like a female? We know about this now, and thank God we're becoming more and more educated. But there are still people out there who want to fight it.
What about Adderall? You hear that more and more people are taking Adderall, especially kids in high school and college, so they can stay up later and study more and cram for.
It is unbelievable how much Adderall you see in universities. And that goes back, to Adderall use goes back to the Great World Wars when they wanted to keep soldiers up. I did an article called years ago for the New York Times, which you probably can still get a hold of online, called Generation Adderall. I was interviewed in the article. Casey Schwartz, a very excellent writer for the Times, interviewed me. And it's, God help you what if you have heart disease? What if you have a heart murmur? I'm not a cardiologist, but, and you're using Adderall, it can do all kinds of things. What if you don't sleep? What if you have insomnia and you don't tell your doctor that you're abusing Adderall or other medications? And there are some medications, people do have ADHD,
Right.
attention deficit disorder, and hyperactivity. I mean, these are real things. So you're walking a fine line.
Right. What's the role of social media now in adolescent drug abuse?
Horrific,
Horrific.
horrific. We need to start to use social media, and we're starting to see it in certain areas where we let youngsters know that what they think about every single drug may not be so true. Let's use marijuana as an example. As we said earlier, marijuana might not be the be all and end all because they legalized it. Now, I said earlier, I'm not saying they shouldn't legalize marijuana because there are many people who use medical marijuana and it's extremely effective. But you need to know your history. And when it comes to addiction, it's medical history.
So social media is bad news. So
Social media can be bad news. There are many, many youngsters out there. I'm not going to mention any social media platforms. I want to avoid that conflict, but there are many where they have kids who don't know what they're talking about, promoting cocaine, promoting hallucinogens. Now, most recently, microdosing of hallucinogens like psilocybin, mushrooms,
right,
LSD, ketamine is very effective for some people for depression, but under the guidance of a physician.
right.
And yet, kids hear that and they say, "Oh, ketamine! I think I'll get some street ketamine and crush it and put it up my nose." And we saw recently. I'm going to not recall his name, but from that TV show, Matthew Perry,
Right. He
from a
died.
ketamine overdose, and we don't know what else was going on.
Yeah, apparently they found other drugs as well.
Right,
So,
right.
now, speaking of him and rehab centers, you hear all the time in the news that some celebrities have been to like 8 different rehab
Mhm.
centers, and it works for a month or two after they're released, and then they're back into the next one. Why is that, first of all? And number two, are there good ones and bad ones? And how does the average person out there figure out which rehab center is good and is going to work?
Every rehab is certified, and certain certifications, like hospitals, like Joint Commission on Accreditation of Health Organizations, like CARF, and after a while, clinicians know the rehabs that have been around for years. Karen, and I have no affiliation with Karen at this point in my career, but Karen has been around since the late 50s, I believe, and excellent rehab. But there are many excellent rehabs, and there are many celebrities who only go to rehab once, and there are many human beings who only go once, and they get sober. They connect with what's called the rooms, AA, NA, and they get a sponsor. You have to work at this disease. You need to get a sponsor if you're going to go that route. Now, AA isn't for everyone. I happen to like it. I happen to like the fact that there's Al-Anon, there's Alateen. They treat the whole family. I like that notion of 12 steps, but some people can't stand it because they think it's a religious cult. Nonsense. It actually harkens back to Carl Jung's Oxford group. And Bob Smith was a physician who was the co-founder of AA with Bill Wilson. So there's a lot of ways, as I said earlier, to skin a cat. There's a lot of ways. A lot of people get sober. A lot of people get sober and they stay sober. And
So
then
if
there are other people who go to 8 rehabs.
right, and so the good rehab centers, and then
Yeah, and after a while, you definitely know. Um, they're affiliated. There are rehabs like when I founded along with my colleagues, the retreat at Westchester, which was at Cornell Westchester. Um, it was it was part of Cornell. It was an excellent rehab. All we had was 5 beds. We wouldn't exceed 5 beds, so you got intensive treatment.
wow.
That's right. There are wonderful rehabs. They make fun of rehabs in Malibu, like the country clubs. There are great rehabs in Malibu. There are some that may not be considered as great, where they may enable the patients a little bit because they're so famous. But there are many, many great rehabs. And if you go on the internet and you look under some of the rehabs, you'll see who has endorsed them, what's their history, speak to their admissions office, speak to other colleagues, psychiatrists, addiction psychiatrists and psychologists, find out who they use. Yeah,
So they know which ones are good.
absolutely. Yeah.
Tell us about some recent success stories that you've had where people were in really bad shape and you helped to save them.
14-year-old kid in the autistic spectrum, uh, now in his mid-20s, has been sober for 9 years, hasn't used any marijuana, alcohol. In his particular case, he goes to AA, has a sponsor, and now at this point, he sponsors other people. And
Great.
guess what he's going on to be? A physician.
Really?
Yeah.
Wow.
Uh,
Great.
Other people who were in college and had severe addiction to Adderall, and they're on their 8th or 9th year of sobriety, and they have started hedge funds, and they're extremely successful. That's, there's an area on Wall Street, look at all those movies they put out with addiction in them, like Wall Street, right? So we know, there are certain professions which are a little more associated with addiction, but I've had many success stories where I sit with people and I explain to them the understanding, for example, of the interplay between co-occurring disorders, somebody who has fear of public speaking, and as a result, they don't stick with propanolol, a beta blocker, which is not addictive, but they go on to having a couple of drinks before at the dinner before they speak. So I've had many success stories where it's all about education. That's really what it's all about. Yeah.
This has been very informative and educational for me, and I'm sure the audience as well. Correct me if I'm wrong. I think the best way to avoid this whole problem is prevention. Just don't take that first drug ever
Prevention
for
is
any reason.
unbelievably important. Student assistance in Westchester, for example, and the founder of that is Ellen Morehouse. They're just brilliant. They do such great work. The National Council on Alcoholism and Drug Dependence, um, other organizations that really are run by and have boards made up of people in recovery and have a long history of recovery and educational services and groups. And there's no excuse for not being able to afford treatment because there are sliding scales. And if it's all right with you, I don't need necessarily a new patient. But if I can help somebody, I'm glad to. And my number is 646, my cell phone, 942 3 yes, 942 3821. I'm not in this field at this point in my life. because I need to be. I'm in this field because I care very much and love the people I work with. And if I can give somebody advice and steer somebody in the right direction, they can text message me. Be respectful of my, don't do it at 2 a.m. But by the way, all my patients have 24-hour, I'm not exaggerating, 7-day a week access to me, and they're not charged for that. They are only charged for their in-office sessions. So, and I'm not saying
very admirable.
Well, that's how I work. That's care frontation.
That's great. I really appreciate your taking the time to provide us with your expertise and knowledge and experience in this area, which is very important. I'm sure the audience will benefit from this tremendously.
And I thank you for the podcast you're doing, because you're providing your 70th podcast. You're providing an amazing service. God bless you.
Thank you very much. I appreciate that.
Pleasure.